Have you ever felt like you're looking through a slightly wrinkled piece of cellophane? Or maybe noticed a subtle distortion in your vision? It could be due to something called an epiretinal membrane. In this video, we'll explore everything you need to know about this common eye condition, from its causes and symptoms to diagnosis and treatment. So, what causes an epiretinal membrane, often called an ERM or macular pucker? In most cases it develops spontaneously. As we age, the vitreous humor, the gel-like substance that fills the inside of our eye, naturally shrinks and pulls away from the retina. This separation can sometimes cause microscopic damage to the retinal surface. In response, the retina tries to heal itself, and a thin, transparent membrane can form. Other potential causes include posterior vitreous detachment, eye inflammation like uveitis, retinal tears or detachments, eye surgery including cataract surgery, trauma to the eye, and even certain systemic diseases like diabetes. To understand ERM, let's delve into its pathophysiology. The retina, located at the back of the eye, is responsible for capturing light and converting it into signals that the brain interprets as vision. When an ERM forms on the retinal surface, it typically consists of glial cells, collagen, and other components. As this membrane contracts, it can cause the underlying retina, particularly the macula, the central part of the retina responsible for sharp, detailed vision, to wrinkle and distort. This wrinkling interferes with the normal function of the macula, leading to visual disturbances. Epiretinal membranes are fairly common, and their prevalence increases with age. Studies suggest that ERMs are present in a significant percentage of people over the age of 50. While many cases remain asymptomatic, the risk of developing symptomatic ERM increases with age and certain predisposing factors. It's important to remember that not everyone with an ERM will experience vision problems, but it's a condition worth knowing about. The signs and symptoms of an epiretinal membrane can vary greatly depending on the severity of the membrane and its impact on the macula. Some people may not experience any symptoms at all, especially in the early stages. However, as the membrane thickens and contracts, individuals may notice blurry or distorted vision, difficulty reading small print, a gray or hazy spot in their central vision, straight lines appearing wavy or crooked, metamorphopsia, and in some cases, double vision in one eye. The symptoms often develop gradually over time. Diagnosing an epiretinal membrane typically involves a comprehensive eye exam by an ophthalmologist or optometrist. The exam will include a visual acuity test to assess sharpness of vision, and a dilated eye exam to allow the doctor to view the retina and macula more clearly. Optical coherence tomography, or OCT, is a crucial imaging technique used to visualize the layers of the retina and confirm the presence and severity of the ERM. The OCT scan provides detailed cross-sectional images, allowing the doctor to assess the degree of retinal distortion and the impact on the macula. Fluorescein angiography may be used in certain cases to evaluate the blood vessels in the retina. While there aren't distinct types of epiretinal membranes in the traditional sense, they are often classified based on their severity and impact on vision. Some doctors use grading systems based on the OCT findings and the degree of retinal distortion. It's more accurate to think of ERMs along a spectrum, ranging from mild, asymptomatic cases to severe cases that significantly impair vision. The decision on whether or not to treat an ERM depends largely on the patient's symptoms and how much the membrane is affecting their daily life. Treatment for epiretinal membranes varies depending on the severity of symptoms. In many cases, if the symptoms are mild and do not significantly interfere with daily activities, no treatment is necessary. Regular monitoring is recommended to track any changes in vision. However, if the symptoms become bothersome and affect vision enough to impair reading, driving, or other essential tasks, a surgical procedure called a vitrectomy with membrane peeling may be recommended. During this surgery, the vitreous gel is removed, and the ERM is carefully peeled away from the retinal surface. This allows the retina to flatten and hopefully improve vision. The surgery is typically performed under local anesthesia on an outpatient basis. Unfortunately, there is no definitive way to prevent epiretinal membranes. Because many cases are related to age-related changes in the eye, it is difficult to prevent the spontaneous formation of these membranes. However, managing underlying conditions like diabetes and controlling eye inflammation can potentially reduce the risk. Regular eye exams are essential for early detection and monitoring of any changes in the retina. Early detection allows for proactive management and timely intervention if necessary. The prognosis for individuals with epiretinal membranes is generally good, especially with timely intervention. While vision may not always return to pre-ERM levels after surgery, many patients experience significant improvement in visual acuity and a reduction in distortion. The success rate of vitrectomy with membrane peeling is high, But as with any surgical procedure, there are potential risks and complications, such as retinal detachment, infection, and cataract formation. Research is ongoing to explore new and less invasive treatment options for epiretinal membranes. For instance, studies are investigating the use of pharmacological agents to prevent the formation or progression of ERMs. Staying informed about the latest advances in retinal care is crucial for managing this condition effectively.